you,
Thank
Allie.
you, Allie.
Well, speaking of those
On that
allergies, not that I want to just, shout out my medical records or anything.
Carson with the HIPAA violation here on Unscripted on 13 Plus.
Honestly, though, I'm allergic to everything. I actually just missed a call from my ENT talking about my allergy shots that I have to get here because I'm allergic to everything. But for those folks who maybe aren't as allergic to the world as I am, this time of year, it's bad.
Yeah, it does get bad, and obviously severity for some is worse than others. Carson literally asked me one day, like, do you just kind of feel like you can't breathe? And I'm like, no. Most people actually don't feel like that, so you should go to a doctor for that. And we did, and we got it figured out.
Yeah.
But it affects everybody. I know I was feeling a little drippy this morning, and you kind of get that headache. And
Typically.
it's not fun.
No, it's not fun at all. Those folks who get kind of more sick during allergy season, the congestion, the runny eyes, the red eyes, the scratchy throat, all the things. So actually sat down with a pharmacist from CVS, talked a little bit about different things you can get that are over the counter, and that if you're like me and you need some more
the high-end stuff.
She has some information about that as well.
Springtime in Arizona, everything's blooming. It's not the best for our allergies. So tell me a little bit about what people may be experiencing and why they might experience it more this time of year.
Absolutely. So patients can experience mild, moderate, or severe allergy symptoms, and that's something that can be evaluated by the local pharmacist if our patients stop in and have a quick conversation. Patients can also go on cvs.com and they can schedule an appointment either via telemedicine or in person with a nurse practitioner at the Minute Clinic to evaluate those symptoms. Certain treatment options, we're looking at antihistamines, corticosteroids, and decongestants. So antihistamines, antihistamine, it's going to block that histamine, so we're not going to have anything that runs. So no runny eyes, runny nose. Those products are going to help with that for our patients. We also have decongestants. So decongestants are for patients who might have that stuffy nose, the pressure involved there. That's going to help to open up those nasal passages so they can breathe a little bit better. We also have nasal sprays, so that's going to be the corticosteroids, and the corticosteroids are also going to decrease that swelling in the nasal passages so our patients can breathe better. For patients who prefer not to use the medicated options, we also have the non-medicated versions of a saline nasal spray or other types of nasal washes as well that can help.
And why exactly do we see these symptoms more in the springtime? I know some people suffer all year round, myself being one of them, but a lot of times we're like, oh no, it's allergy season. Is that just simply because things are blooming?
So yes, so we do see increased allergens during these months in the springtime months. So that does have something to do with everything blooming, increased pollen counts, increase in juniper ash, all sorts of other things that are out there where people might be allergic to. And we just want to make sure our patients are protected even ahead of time, especially if they know they're susceptible to allergies. So ideally, if patients can begin therapy about 2 to 4 weeks in advance, that'll actually help them so that during the full-blown allergy season, they have minimal, if any, symptoms at all.
Awesome. So one thing that we've been talking about a little bit is a lot of people have dogs and they go outside, run around, and then they come into your house. Could they actually be bringing in some of those allergens into your own home? Have you ever heard of that? Or is there a way we can try to avoid that, or any suggestions?
I mean, absolutely. So if we have pets that are outside, they are definitely bringing in allergens into the home setting. So we do want to do our best to minimize those if at all possible. Sometimes that may be challenging. But in that case, that's why we do have the allergy treatments available. So the antihistamines, the decongestants, the corticosteroids. Allergy symptoms, those can be the mild to moderate to severe. So if we do have patients that have severe allergy symptoms, we would recommend that appointment with a nurse practitioner at a Minute Clinic location just to evaluate that. And they can prescribe an inhaler and also a steroid to decrease any of those troublesome allergy symptoms, which could be difficulty breathing, anything that's alarming, and that can be treated right in our Minute Clinic locations.
Well, as you just heard, not the best time of year.
Not the best time of year.
It's gorgeous.
It is a gorgeous time of year, yeah, but breathing-wise, it's not super great. And there are other things that, of course, contribute to that, as you learned.
I know.
So I think a lot of us, I know for me, like Harley's lot up on the couch, up on the bed, all the different
Me
things.
too.
But you don't really think about it until like he goes out and he gets dirty and then jumps up on my bed. You don't think about all the things that your pets accumulate on their fur when they're outside. And then if they do go up on your furniture, right where you sleep at night. So Carson likes to show me videos of her dog asleep in bed, or like pictures that her husband will send her where they're taking a nap. And that dog, that sweet baby golden retriever, who, as you know, has a lot of fur because golden retrievers do, is laying on Carson's pillow. The same dog who is outside getting covered in pollen and grass and everything
And
that Carson's allergic
shedding.
to. And then taking that fur, like a little like mop full of fur, and putting it on Carson's pillow with all the allergens on her pillow.
I'm really not helping myself here. We just love our furry friends. And we know also they shed more this time of year. They're kind of losing their winter coat, getting ready for the summer. So that's not helpful. So there's actually one company, Fur Zapper here, who came out with a product to help get that fur and those allergens out of your clothes and really anything else that you can wash. So I spoke to one of the sales managers.
Scott, just to get started here, tell me a little bit about the product that you guys have. And of course, we all know allergies right now are crazy. It's spring, everything is blooming. So how will this help those folks who suffer from allergies?
First, if you have pets at home, you love your pets, but not necessarily all that pet fur everywhere. It gets everywhere. It gets in the air. It's on your laundry, your bedding, your blankets, everywhere. So easily, Fur Zapper works. You just throw it in your washer and dryer with your clothing, and it helps remove the fur as you wash and dry your clothes. So in the washer, it kind of acts like as an agitator as it's tumbling around with the clothing. The tackiness will kind of pull the fur off, but then release it, and everything in your washer goes down the drain. So maybe about 10% of the fur comes off in the washer, but really where it works well is the dryer. So if you were to touch it, I don't know if you had samples or whatnot, but it's very tacky. So in the dryer, it heats up, gets even more tacky. So as it's tumbling around, it kind of catches the fur, but this isn't like glue where it's going to stick to it the whole time. It will actually, it's like a catch and release type thing. And in your dryer, everything that's in your dryer air gets filtered to your lint trap. So you open up the lint trap and you'll notice so much more fur than you normally would get.
Super interesting here. I know folks might be allergic to their dogs or their cats, but also something to keep in mind is that your dogs can actually bring in a lot of those allergens from outside, especially during the springtime. Tell us a little bit about how this helps that.
Yeah, so really anything. I mean, it's not only fur and hair that it works on, but lint, dander, any other allergen particles that get on the dog and they get back on your furniture and your clothing and all that. So I have family members, that don't have pets, but they use it just because they have long hair. And it really works on that. It works on long hair. It works on just the kind of pilling on your clothes, the fabric really cleans everything up.